Haitian proverb says, as long as your head is not cut off, you can wear a hat. Meaning, as long as there is life, there is hope. In this video, you are going to learn how to thrive with HIV. How do I tell others about my HIV status? It's important to tell all of your healthcare providers about the HIV so they can provide better medical care and can also take extra steps to protect themselves from getting HIV while caring for a person with HIV. In most states, there are laws that say a person with HIV has to tell their sexual partners or injection drug use partners about their HIV status. If a person finds out that he or she has HIV, the health department or medical clinic can let sexual partners know about the HIV so the infected person does not have to tell them. Telling family members and friends is important as they may be able to speak for the person with HIV in case of an emergency or may help that person care for their HIV. Trusted family and friends can also provide emotional support and can help inform others about the HIV disease without divulging patient status. Family and friends may not know how to behave around a person with HIV for fear of catching HIV. It may be helpful to say, if a person is under HIV treatment, you can't catch HIV by shaking hands, hugging, sharing toilets, sharing dishes, silverware, or drinking glasses, or engaging in closed mouth or social kissing with a person with HIV. Air or water transmission, saliva, tears, or sweat that is not mixed with the blood of a person with HIV. HIV can't be transmitted through healthy, unbroken skin. I want a family, but I have HIV. It is possible to have a baby when one person has HIV and the other does not, or both partners are infected. It's important to discuss family planning with a doctor to prevent the spread of HIV to the partner and the baby. Family planning techniques can include having the HIV-negative partner take HIV medications to protect him or her from getting it through sexual contact. Women with HIV can have healthy pregnancies, but there is a risk that HIV can be passed to the baby during pregnancy, childbirth, or breastfeeding. To reduce that risk, women with HIV have to take the HIV medication every day and have low levels of virus in their blood, or viral load suppression. Babies that are born to mothers with HIV can be given medicines after they are born to reduce the risk of having HIV. HIV can be passed down to the baby through breast milk. Women who have HIV are recommended not to breastfeed. Use of alcohol, tobacco, and drugs. Does drinking alcohol affect HIV? Drinking too much alcohol can weaken the immune system and can put the person with HIV at risk of getting sicker from illnesses and HIV-related diseases. A weaker immune system also increases the chances that a person with HIV may experience more side effects from the HIV medications. How can smoking or using tobacco affect my HIV? Individuals with HIV who smoke may develop more cancers in the lungs, head, or neck, and may have problems that affect the mouth. Smoking also affects how a person's body responds to HIV medicines, can increase the chances of getting AIDS, and can affect how long a person lives. Smoking marijuana or pot or any other drug irritates the lungs. It can lead to serious lung infections, such as pneumonia. I don't want to stop alcohol and drug use. What will happen to me? HIV medications can be hard on the body, especially the liver. The liver is responsible for getting rid of waste products from the medications. Alcohol and other drugs affect the liver the most. A weaker liver means it is less useful in cleaning waste from HIV medications, alcohol, and other drugs. A person with HIV may react differently to alcohol and drugs. It may take longer to recover from using alcohol or other recreational drugs than it did before the person had HIV. Can I work while I have HIV? People who receive the health care they need and take medicines the way they are supposed to be taken can continue working with the help of their employers. To continue to care for the HIV, people may need to ask for time off to see their doctor. It may not be necessary to mention the HIV, but instead to have a doctor's note saying that he or she needs to be seen more frequently than other people. How do I keep my sexual partner safe? Taking HIV medication daily as prescribed and having an undetectable viral load can reduce the chances of transmitting HIV to a partner without HIV. Using condoms during vaginal and anal sex can also significantly reduce the risk of getting HIV. Talking to sexual partners about medications that help reduce their risk of getting HIV, called PrEP or pre-exposure prophylaxis, is also a way to protect sexual partners. Aging and HIV. I've had HIV for years. Am I at risk for other health problems because of my older age? Yes, some people in their 50s and older with HIV may have problems with their heart, lungs, liver, brain, and for some people, they may even have some types of cancers. But if HIV is controlled, the risk is diminished. Traveling and HIV. People with HIV can travel, but may need to discuss their travel plans with their doctor months before it occurs. Some countries may require vaccinations, and it's important to discuss these with your doctor, as some people with HIV may need more laboratory tests to make sure that the vaccines worked correctly. People with HIV may need to bring extra medicines, such as antibiotics, or may need to take medicines before they travel to prevent dangerous illnesses, like malaria. Thank you for taking a moment to watch this video. I hope that it has shown you that it is possible to grow your family, work, travel, and thrive with HIV. Remember, if you have any questions, please speak to your nurse or doctor.